Okay, hello, Lauren.
Hi.
I first want to say something. So, we met the first week that I moved to New York.
Yes.
I moved to New York on a Tuesday,
And you
and then
came to my event on a Thursday, which
and I
was
was there
insane. I was so excited to hear that.
I was there on a Thursday, and my I keep saying my life is in shambles. It's not, but I had everything that I owned was in a box. Some of it's still in a box, and it's probably
Could
going to
be.
stay there for a while. But yeah, I met you the first week that I went here, like 2 days in. Just moved to New York City. And it was awesome, and you're so charismatic, and you can, like, work a room, like, that room is your bitch, like, you know exactly what's going on.
I love you for that. I have a background in entertainment industry studies. So that was like my first life was planning stuff and running events and running around and working different things, but like not being the personality, but more so being the behind the scenes gal.
Mhm.
So it's fun to be the personality now, I guess.
Well, you can turn it it's like, it's fun when you have a reason to turn it on, and then
Yes.
you kind of can use it, and you can go there, and
And I care so much about those things because I'm like, I want everybody to have fun and talk to people. And who do you need to meet? Oh my God, you're brand new to New York City. Let me find you six friends.
You're really good at that too. I was really nervous before I came in. I was like, "Oh my god, I'm gonna be in the corner, like, drinking a Pellegrino and, like, whatever," but
You weren't though. You were working the room too.
I was working, girl, I was clocked in.
You were
Mhm,
networking and you are doing it now. So welcome
mhm.
to New York. I'm so happy you're here.
Well, thank you, thank you, thank you. I cannot not hear someone say "Welcome to New York" and think of the Taylor Swift song.
Oh
Like,
yeah, of course.
it's there.
Arguably, like, no, I love Taylor, but like maybe one of my least favorite songs, but still.
Really? We should unpack where do you feel that in your body?
Yeah, right.
Um, so I'm curious about you. We're gonna talk a little bit about eating disorders and disordered eating,
Yes.
and we're gonna go into that avenue. So I'm curious, first off, you said you had a background in media. What happened with the switch to therapy? Where did that come from?
Well, New York City, as you will find out, is a city that chews you up and spits you out. And there's a lot of toxicity in certain job fields. And for me, I mean, my eating disorder was prevalent way prior to moving to New York. But when I moved to New York, I think it got really like maybe the worst it had been. Maybe I don't know. It was pretty bad in college too, but I don't think I had any like language for it. And I think I had such strong like social friendships and like, I don't know. In college, you know what you're doing. You're getting to the next exam and you're doing the next thing. I think when I got to New York, it was like, oh, it's your time to be successful. Like you have to figure this out. And that combined with like a toxic job situation and combined with like just the place that I was in my headspace just declined my mental health and basically like the only way I redid my whole life or like got out of that cycle and that pattern was by going to treatment. And I was really lucky because my mom worked for a big university. So I had really good health insurance. And I know that most people can't go to residential or go to a higher level of care because they can't afford it. Right. Or like, they can only go for a certain amount of time because insurance is only going to cover a certain amount of care. So I was lucky enough to be able to go and like totally restart my life from that place. So I focused only on my recovery and like moved out of the city and went back to Connecticut. I was like living in my parents' house. I was like, awesome. Um, and then when I came back, I couldn't really decide what I wanted to do, but I didn't want to go straight back into the world that I was in before. And was like, maybe I should help people the way that I had been helped. And something about that kept coming up for me. And it's interesting now, like looking back on it, I feel like my current present day career really combines all of the things that I have worked on and been passionate about and trained in and all that stuff from like TikTok to writing a book on recovery to doing all these things that are still like almost like entertainment focused in a way, but combined with like education. So I went back to school and then I knew I wanted to have a business. I was like, yeah, I'm not about like working in a hospital after I had already gone through the system myself. I was like, I'm not going to be on the other side of this. Like, I'm not going to go back and do exactly what I like, what the process or the program that I was in. So I was like, I want to do a private practice. I know that for sure. And I want to work with eating disorders maybe at a higher functioning level. And I want to work with relationships and I want to work with trauma and like I want to work with all this different stuff. So I got an internship with a private practice and then I ended up getting a second job with another private practice and then eventually started my own. So that's a little bit of like my journey.
So that's first of all, thank you for sharing that. That's like a lot of really good information. And also it's interesting too because I've noticed as I've kind of like slowly entered the field that the personal experience that you have,
Oh,
there is I don't even think this needs to be said. Like there is no comparison to personal experience with an issue than some kind of training or some kind of course or whatever.
yeah.
So it's really interesting to hear also therapists like breaking the what is it like breaking the third wall or breaking the fourth wall or whatever and
Yeah,
being like, hey, this is an experience that I had as well.
right.
Because yeah, I mean, I think there's so much there. I want to go into like some of the logistics too.
Yeah.
So what is and I'm like, I'm not super familiar on all of the terms when it comes to like eating disorders and disordered eating.
Perfect.
So I'm curious about is there a difference between those two terms
Mm. Like eating disorder and disordered eating.
versus disordered eating?
So, yeah, I was thinking about this morning and I was thinking about there's obviously DSM criteria for an eating disorder, right? But I do think it's so much more than that. And I think in our society, I could argue everyone has had some sort of touch of disordered eating. I don't know if your life has just never been touched by diet culture. Like, I wouldn't buy that, especially in the US. Like, you could even meet the healthiest relationship with food person and they still might have an idea about food that if they wanted to lose weight they should cut out x y or z, and that idea is from society kind of putting that onto them or relationships that they've had or experiences that they've had with other people to right impact their relationship with food. And I think that it's really really hard to find somebody who doesn't or hasn't had some experience with disordered eating in some way. They may not realize it, but it's pretty like omnipresent. I would say when it becomes a problem or a disorder is when it's impacting your mental, physical, occupational, relational functioning, right? It's the same thing as anything else in therapy. We're looking at how is this impacting your mental state, your emotional state, your relationships, your life? Is it impeding your ability to do the things that you need to do, or is it impeding other areas of your life, or is it a threat or risk to you in some way? Disordered eating is so hard, and working with a population of a lot of young women and also men, which I feel like they get kind of taken out of the conversation a lot of the times, but want to talk about disordered eating, I feel like men stay in that area and then never even think that it could ever be an eating disorder only because they're men, which is really interesting. Like you hear about gym culture, or I know for gay men it's really really prevalent. There are certain stereotypes of how you fit into the gay space, especially in a city like New York. So there's like I could say so many different things about it, but there's no like test that I would say, okay, your disordered eating is safe and your disordered eating is problematic. It's individualized and it's how much brain space is this taking up for you? What emotions is this causing you? Are you avoiding doing certain things in your life because these other thoughts and feelings and behaviors are taking over all of that? And, are your relationships suffering? Are they noticing? Are you isolating and all that stuff? So it's like there there's so many things I could say about the differences, but I would say someone could probably have disordered eating for their whole life and never address it. You probably can't have an eating disorder for your whole life and never address it, if that makes
Okay.
sense.
Yeah, that's
Or
really
never
interesting.
have it pop up and be a problem.
It's something that you're like, I have to deal with this. This is something that
Yeah.
I can't ignore. It's interesting when you were talking about one of the things that was popping up for me was when you talk about men not realizing that they're having disordered eating, and I immediately think of the gym culture, and I
Mhm.
immediately think of this is what's on my feed. Your feed, I don't know about your Instagram feed or anything
Yeah.
if it's a little different, but for me, it's like a lot of these photos of men with these perfectly sculpted bodies. And
Mhm.
a lot of it is one of the big challenges is like my day of eating, right? It's like what I eat in a day.
Yep.
And then it is, of course, I think it's bullshit because I'm
Yeah.
like, this is not what you eat. You
And
don't
if that's
eat.
what you're eating and you're showing a very small amount of food, you're binging at some other point. There's no way
Hmm.
your body is not getting that calorie count back at
Hmm.
another point. There's just no way. So yes, I agree.
Yeah,
They're
and
giving
you're not eating like an acai bowl every day for
I
breakfast,
mean,
and
and
that's
if you
consistent.
are, you
That's not
must be
true.
so bored.
Hmm. I I know. I'm like, oh my god, literally. I'm about to gag myself. This is literally what's on my counter right now.
No,
Um,
literally, I was thinking about if I could have sour the I just bought the sour grapes, the Fruit Riot. Have you ever had them?
no.
They're basically like frozen fruit that they put sour candy coating over.
Oh, I know exactly what you're talking
And I
about.
was like, "Could I have that for breakfast?" I'm like walking home. "Could I have that for breakfast?" And then I was like, "Maybe go with like a granola bowl and like have that for
Hmm.
dessert." But like truly, like I don't have any food rules anymore. And if that was something that I really wanted to try for breakfast, I would. So like we're in the
And you're
same
an
boat.
adult, so you
Yeah,
can do whatever you
you can
want.
do whatever you want.
Which is the beauty of being an adult. But yeah,
Yeah.
there's this culture, especially this gym culture with, and this my like perspective is coming in a little bit here that I see a lot with men and this rigorous dieting and rigorous working out like every single day, all the time to achieve this kind of standard that is. I think there's a lot of like anabolic steroids that are used as well. So I don't think that it's even particularly just diet and exercise with some of the Instagram models.
Yeah.
Don't come for me. But anyway, but yeah, so
Yeah.
I'm
And the
curious
thing about
about.
these what I eat in a day is, and like I document a lot of my life, and I document
Mhm,
sometimes food is a part of that because one, I just want to like encourage people to eat, and two, now I like love food and I love going to cool restaurants, and like I just
mhm,
love like showing that part of like New York City culture and like hopping around to different fun places. But you will never see me do what I eat in a day.
mhm,
One, because they're so triggering. Two, because I do not want anyone to compare what I am eating in a full day to what they are eating because we have different needs each day. We work out differently. We have different height and weight. I don't even know. Some people don't believe in set points, but like ranges of what our bodies are supposed to look like and what's supposed to be. And if
mhm,
you eat like me, that doesn't mean you're going to have my body. And I didn't understand that until I went through treatment, right? I would try every single person's. I would wake up every Sunday and find somebody else's to emulate Monday, Tuesday, Wednesday, Thursday. And I was always trying a different something to see if I could reach a different goal. And that's also why, because that's what my feed used to look like macro counting. And it wasn't really like, now there's skinny talk, horrible. But it like was like this like sneakier thing that wasn't like, oh, here's a way to have an eating disorder. It was like, here's how to get the body that you want, or here's how to, XYZ. But what people aren't really realizing or thinking about is most of the time it's not about their bodies. They're looking for something else. They think,
mhm.
oh, if I have that body, I will feel, oh, there goes my light. Damn it.
You girl, you are your own light. You are my light.
No, that's what. See, this is what I'm talking about. Whenever I try to use anything technological, it dies at a certain point. But like what was I saying? God damn it.
You you were saying, do I even know what you were saying? Oh my god.
Nope. Let's bring it back. Bring it back. Okay. It's not necessarily the perfect body. It's the life or the
Mhm,
relationship to self or the relationships to others that you think you will have if you have the perfect body. So it's usually like a convoluted way of thinking that you're going to get happiness or peace or love or any of those things that are actually more related to your traumas or the ruptures in your life that have created some sort of understanding that you have to be different or better
mhm,
in order to be loved. So, these are the things that we talk about in therapy because and like your point, due to my personal experience, I understand why there's certain exercises and why there's certain, behavior changes that need to happen when you're so stuck in an eating disorder pattern. But what's the most important is figuring out what's underneath and why you developed these behaviors and thoughts and feelings about food and exercise and body image in the first place. Because usually this is just a tool that we're using to find some sort of control or to see if we can kind of try to move our lives forward in a way that we think will make us happy. But
mhm.
then it's really turning into the thing that doesn't. lead to any happiness, and it actually gets in our own way. And that's sort of like, then it's like a self-sabotaging thing.
Mhm. Yeah, I think I was gonna, my next question was gonna be, what does that look like in treatment? So,
Yeah.
it's interesting what you're talking about of it's almost, like, congruent with a lot of the things with the disorder, right? Is that it's, like, it's very surface level, and it's very the impression is, if I fix this thing, then this avenue over here will work. Or
Mhm.
if I have this perfect diet, or if I have this, whatever, then these other things are gonna fall into place. What in treatment is that the primary what does treatment look like? Let me not guess.
Yeah.
Like, yeah,
So
what does treatment look like?
most treatment centers utilize the combination of CBT, DBT, maybe some mindfulness. They are, in my opinion, like trying to stabilize. They are trying to eradicate and take away as many of the behaviors that you're using and kind of like disrupting your emotional state in a safe environment. And we don't have enough time today to talk about how like re-traumatizing and triggering treatment centers can be, and how much I think we do need to like move towards a more um, client patient centered approach, because I do think that there's a like punishing element of like you're now stuck in this place, you have no phone, you feel like you've done something wrong to be there, and all these people are like telling you what to do. And as adults, that's a really really hard
Mhm.
to conceptualize, and it creates this idea of the resistant client or the resistant patient, when really what we need to dig into from like a parts work perspective or from a trauma informed lens is like, this is serving you in some way. This is helping you. This has been a coping mechanism and an adaptive part of you that has developed. Let's explore what it's trying to do for you versus like these behaviors are no longer available to you. And if you do them, you will be punished,
Mm,
which is like, I mean, I'm really boiling it down to like, black and white thinking just to give you guys an idea of like what it can feel like. But even with saying that, I do credit the disruption of my life and my patterns to treatment and going to treatment, because I don't think, I mean, I was trying. There was a time period where I had accepted that I had an eating disorder. I knew that I needed to change it, and I was trying to do it myself. And for me, until I got completely out of my environment, until I got completely like away from the ability to continue my behaviors, I couldn't like restart, restabilize. So that's kind of what I credit eating disorder treatment centers and programs with, is the ability to give people like a new start with their relationship with food and teach like certain things like that. It sounds so basic, and maybe, maybe it won't, but it's basic to me now. But like how to create a meal, which is a
mhm,
protein, fat, carb, and a vegetable or fruit, and what appropriate portions are, and how to, well, you don't really get to practice eating when you're eating when you're hungry and stopping when you're full, but when you're eating consistently enough, then your body actually starts to have hunger and fullness cues again. And then after that, you have the ability to start learning something like intuitive eating. So I kind of saw my treatment program. So a treatment program is like you eat at certain times, you go to therapy at certain times, you go to group at certain times, and you're doing all these thought, feelings, behavior exercises to learn how to reframe and learn new skills for when these urges and desires come up, and try to understand a little bit more of where they're coming from. I always like feel and say, when my recovery got the best, or when my recovery really became like mine, was when I moved back to New York. And I had all of the basis of what it's supposed to be to have like a healthy relationship with food, all of the understanding and the education and knowledge from treatment. And then I got to like apply it to my real life.
mhm,
And that's why I chose my program, because it was mental health counseling and wellness. And I was like, that's what made sense to me, was focusing on my like overall wellness and my personhood, and like how do I live my life and integrate these things, rather than like being a recovery like stickler for the rest of my life. Like, I eat pretty intuitively now, and I love working out, but I know when to rest. And I still, drink alcohol, but I try to like work on my relationship with that. And I like feel like when you're in treatment, you have so little freedom. And then when you come out of treatment, I really like to help clients now develop like autonomy over their recovery, if that makes sense.
It
Instead of
does.
continuing to listen to what someone else tells you, I want like the client and patient to take ownership of it and decide this is, I want recovery and this is what it's going to look like in my life.
Mhm. Where did you mentioned your program. Where did you go to grad school?
I went to NYU.
So I thought you did. That's so interesting because I, well, before I went to my program, I looked at them and they have their track specifically says like health and wellness is what their like program.
And like, I just, something about that really spoke to me, especially wanting to go into the private practice world. I was like, I just want to be incorporating all these different things that, again, in my personal experience, work really well for me. It's like, it's walking the walk. There's no
Mhm,
quick fix. It's going to, be a long road. And so I'm writing this ongoing recovery workbook, and it's hard because it's a workbook. So like it does have a lot of like CBT and CBT focus to it, because how do you make a worksheet without something like that? But then it also has like every other chapter is more like relationally driven prompts, like some of the questions that we've been talking about. And when I first spoke to somebody in the field, like much more senior to me, about writing this book, she was like, well, people want hope. People don't want to hear that they're going to be struggling with this forever. And I'm like, but some people will be struggling with this forever. So what are we supposed to do? Not give them any tools?
mhm,
Like the whole idea, I think, in like a healing journey is like you're managing and you have maintenance with the things that you struggle with. And that's why I believe in long-term therapy. And that's why I believe in, taking good care of yourself every day. It's like you don't just go get your eating disorder taken care of and then never think about it again.
yeah, it's similar to what when people with substance use disorder too. Is it's like oh people will let's go to rehab. We'll send them to rehab and then they'll fix them and they'll come back and they'll be fine.
Right. And it's like, no, no, no. Especially if they're going straight back into the exact same environment that they were using in, it's going to be very difficult. You have to learn new habits and behaviors and maybe make new friends and maybe, have a, yoga practice or maybe, have some sort of something else that you are actively participating in that's fighting against the urge to harm in that way. Because I do see, in some ways, I do see eating disorders at their most extreme as a version of self harm as well.
Mhm. So I'm gathering you predominantly work with your clientele is mainly eating disordered eating.
So I like market myself as eating disorders, trauma, relationships, and anxiety. So we
Hmm.
have a nice mix of higher acuity clients that maybe need a little bit more care and lower acuity who are like just the girly pups in New York who, want to go to
Like
therapy.
me.
And yes, exactly.
Hmm.
Like just kind of like everyone I think could benefit from therapy, and it doesn't always have to be the most extreme, most tumultuous time of your life to go.
Hmm.
And so the balance for me is, well, if someone has struggled with an eating disorder and knows that they struggle with an eating disorder, there may be unresolved trauma that we need to address that they didn't get a chance to address in treatment because treatment centers aren't set up for that, right? So there's those two things kind of can sometimes go hand in hand, and there's a lot of crossover with that. And then dating and relationships and anxiety, there's a lot of crossover with trauma and childhood
Hmm.
and attachment wounds and all that stuff too. And then there's just so many people who come to therapy and never have thought that their relationship with food is problematic at all. So we may be marketing to people with eating disorders, but then someone might come in and say, I don't have an eating disorder. What are you talking about? And then we get 6 sessions in and it's like, "Oh, no, no, no. Eating a rice cake for dinner is actually not an appropriate amount of food for anybody. We maybe need to look at this a little bit deeper." So,
Hmm.
I, like, strategically, like, planned my specialties for those buckets, but they do have a lot of
Hmm.
overlap.
Yeah, and especially in New York City, it's like, in other like bigger cities, I think there where the market, I think the word you said like several minutes ago or earlier was competitive, of like
Mm.
competition, of
Yeah.
there's this idea of this like hustle culture and you have to be the best and you have to do X, Y, and Z.
Well, and
And
there's so many
so
creatives, and
mhm,
the entertainment industry is really toxic. The fashion industry is really toxic when it comes to food. Everybody here, if you came to New York, you came to do something big. You're not here to like casually mess around, right? Like you're
mhm,
usually here to be successful in some sense of that word, whatever that word means to you. And I do think that discipline and hustle culture and yeah, competition and being the best sometimes does get caught up in eating disorder order culture as well.
mhm. What is what does treatment for eating an eating disorder look like outside of the residential
Yeah, so
world?
this is where it's really tricky. So we're virtual only, which can be
Mhm,
a bit of a challenge. So we are not seeing our patients or clients, and I use that word interchangeably because we're talking about kind of two different systems, but we refer to our people as clients who come to our practice. We're not seeing our clients in person, so that can be a little bit of a challenge with the touch points that we have for like let's say like extreme weight loss. But then there's also the fact that you cannot see an eating disorder. So when we are working with somebody who maybe has more extreme presentation of an eating disorder, it's our ethical responsibility to try and offer higher levels of care because once a week virtual therapy for 45 minutes is just simply not going to be enough to address both the food, behavior, thoughts, feelings, and whatever's underneath. So, our ideal client has already had some sort of recovery aspect in their life or is maybe very new to this and might maybe lean towards disordered eating versus an eating disorder. It kind of depends. But when we address or identify that there's an eating disorder present, we would then try to recreate a care team for our client. We would do maybe, let's say, 2 times a week. Let's say we get you a dietitian. Let's say if we see maybe we need some psychiatry, like maybe we need, like, because that's what you have at a treatment center. You have meds, you have a nutritionist, and you have a physical doctor, like you're being like, taken care of with all of your blood work and all that stuff. So those are the types of steps that we would take. And it is really hard and challenging because a lot of people just say we don't work with eating disorders at the outpatient level. Like, not for us. They'll do a screening, they'll refer out. I would rather have people have some care than no care. And I
mhm,
would rather people not have a negative experience with a therapist who just turns them away because they start talking about their relationship with food. So we're going to do everything we can to preserve that therapeutic relationship that we've built and then push when we need reinforcements.
mhm. What So I'm curious about also, which by the way, I've said this like 12 times
No, you're fine.
with other people, but like I'm curious about has become my like new thing. I like that's all I say now is
That's
I'm
all you need
curious
to
about
be. To be a good therapist, all you have to be is curious
thank you.
and trauma informed.
That's all I say. And I was talking to my sister the other day and she said something and I was like, I'm curious about why you did that. And she goes, Dustin, we're not gonna do this.
Get the hell out of here.
Yeah, she's like, we're not gonna do this. Um, but but yeah, so I'm curious about like with people coming in and earlier you mentioned about kind of not knowing that these food thoughts or I've heard it called food noise. I don't know if you're
Yeah, food
yeah,
noise.
that they have this like food noise, but it's not something that's central to them and it's not why they're and it's not from the client's perspective that's not why they're coming in and they're kind of having this noise about maybe I should say what food noise is first.
Yeah.
Um well actually I want to hear what your definition of food noise is.
I feel like it's just this like overwhelming um brain space
Uh-huh.
that dialogue, internal dialogue in your brain that centers around food or body or exercise or when you're going to do this or numbers or
Uh-huh.
almost like a news reel. Like when you're watching the news, there's all these little things that go on down at the
Uh-huh.
bottom, right? There's all these other breaking newses going just constantly. And yeah, it's what am I going to eat for lunch when you've already like made it halfway through your breakfast and then dinner is the same way. And then should I have eaten that? And then it's thinking about the guilt and the shame. And there's usually a lot of those types of emotions associated there, like guilt, shame, disgust, overthinking times a million, but it's all kind of centered around those food, body, exercise thoughts. Is that a good
Okay,
definition? I've
that
never
was
really looked it up.
girl, that was way more elegant than whatever garbage was gonna come out of my mouth. That sounded way better. Um, yeah, essentially, yeah. What you're saying is like this. There's always this thought in the back of your head when food is involved, or when you're having breakfast or whatever. And so when you have a client that's coming in that has some of this food noise, but maybe it's not central to why they're coming in. Maybe they're coming in for something like you talked about, where it's relational, where it's like, any kind of relational issue of I'm feeling like I can't maintain a relationship, or I'm feeling like X, Y, and Z. Has there been a client or somebody you work with in your experience where this thing that seemed to be so small and minimal in the back of their head actually was really influencing all of the other issues that they were coming in with? Is that something that you've seen in your work?
Absolutely, absolutely. It'll be like a aha moment, just like anything else. Like there are reasons why certain topics are harder to talk about in therapy, and they're because they're associated with maybe a deeper, like hurty place with clients, and it's hard to be vulnerable. So I no shame if these things don't come up for a while in therapy because I'm the kind of therapist that I want you to use the space for whatever is helpful for you. If it never comes up ever, there's no way either of us is going to know that it's a problem. I do think that when there's a persistent, maybe depressive or anxious or relational pattern or something, it's our responsibility to ask about these other parts of the client's life and look at them as a whole picture, right? Rather than just the presenting problem that they do bring in. And that's something that I think we should just make more common practice. Well, how are you eating, sleeping, drinking water, exercising? Like those just need to be basic questions I think that we're all asking in our
Mm-hmm.
intakes and whatnot. But if people are kind of presenting that it's not quite an issue and talking about something else, and then we have a moment where it's like, oh, actually, what you're describing is disordered eating. Where did you learn that? And then understanding that at 7 years old, this client, I don't know, was like put on Weight Watchers or something with their mom, and that's how they bonded. Oh, okay. How did that impact you? And how did that impact your self esteem? And how did that impact dating? And how did that impact that traumatic relationship that you were in? And then we follow it all the way to the present day. And it's like, oh, ding, 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 we found one of the roots that might be a little bit more deeply embedded in some of the things that you're working on. But that is sort of the same as a lot of childhood trauma or maybe a sibling or something who struggled with addiction or some family stuff sometimes comes out in the same way where it's like, well, I didn't think to ask. You ever witness a car accident? But then all of a sudden we found out, oh, you witnessed a car accident when you were 11, and that really impacted your fear of driving or something
Mm-hmm.
like that. And it's all in the relationship, how these things come out. And I think it's all in the rapport that the client and therapist have in order to be able to ask these things and then say, I need to know more about that later without pushing an agenda that maybe the client doesn't want to talk about that day, if that makes
Mm-hmm.
sense. So it's a very delicate balance, but absolutely there have been so many times where I've been working with somebody for quite some time and then something comes out and it's like, "Wait, what?
Mm-hmm.
You didn't tell me this?"
Yeah, so that's so interesting. It's just in my like 1 year that I did my internship. I know exactly what you're talking about of we have all these things and all these kind of consequences. It's like this is happening, I have this impact on this relationship, and then something comes out and it's like, okay, well, way to bury the lead. Like that's what we were looking for. I'm because we only have I'm going to be conscious of time. I have
Yeah,
like
yeah,
a
we can go
question I
to
want to ask
50.
you.
We're good.
Um, do you have anyone? I noticed this especially like with when people are treating trauma or when things that are really traumatic come up. So I'm going to keep this in the frame of like disordered eating.
Yep.
So you have a client that's showing up with this issue, whatever. Something comes out, and then that client starts to kind of ghost or pull back.
Mhm.
And I noticed because I had this experience with someone who we really got to where, okay, this is the meat of things. And then they started not feeling well before sessions, or things started coming up. And so it was like getting them in the room or in the virtual room, whichever, was more and more difficult. Is that something that you see when working with people where we've touched on some really like meaty stuff here and now unconsciously even the
Yeah.
client is kind of not showing up?
So I will usually prep clients when I've noticed that that has happened in a session or two, or if I'm noticing their detached state or dissociated state or something showing up a little bit more in the room. I will try to talk about it in the here and now and then say, you might experience something called flooding, which is right where your body built up this dam against these memories and against these things that were really, really painful for you to experience. What you're doing by simply showing up, and this happens in my trauma groups a lot because they've got trauma group on their calendar for Wednesday night. And then, they have to show up and it's really scary every single time. And they're inviting in a hole in that dam, right?
Mm,
And sometimes when it's like an unprocessed memory that's been like deeply repressed or a huge thing like a sexual trauma or something like that, right? The dam breaks and we're so emotionally flooded by either the memory or the coping skills like that we used to use or like all these things will come up and we'll feel really dysregulated. So I'll usually try to prep clients when we're doing that kind of work with how we take care of ourselves after those sessions. And if we notice people ghosting or if we notice people stepping away, I see that as that's their only coping mechanism. And that's the old coping mechanism of avoidance that came up for them that they now need for whatever reason. And they feel that their body is not ready to do
mm,
this work yet. And that's okay too, because I can't force someone to go into those deep and dark places each week. And that's what I'll say. We can have a lighter session this week if you guys want. Like this is in group, there's multiple people. But like I'll say we can talk about something else today. Why don't we maybe do every other? Why don't we, talk about what that was like for you afterward? I'm gonna prep you with some crisis text lines for over the weekend because you might want to self harm or you might want to do any of these things that like come up for you because you're just feeling so much pain, so many emotions, and you don't know what to do with them. So let's find a few ideas, sort of like safety plan. But like those are the things that we really need if we're going to be going headfirst into trauma work week after
mm,
week. And I don't know if most systems are built to do that, right? So especially with work and relationships and like we try to be kind of tactful and make that choice for when we're actually going to go there. And I give those clients that choice and they give me permission to poke in that direction, if that makes sense.
mhm,
But flooding is so common and so normal. And I think that people will open up that door and then be like, I really can't. I would rather choose my avoidance and stay safe in what feels safe to me rather than go there. And that's, again, why I love long term psychodynamic work, relational work, because I've been with most of my clients now. I'm not taking on new clients, as you could have probably guessed, but I've been with most of my clients now for years. So I know pretty much the whole timeline. I know the story in a pretty complete narrative at this point. And what we do is we see what's going on in the present, and then we go back into the past in the timeline and how that is informing or impacting us in the present moment from what I know or
mhm,
from what they've shared with me. And then there is still more to uncover.
mhm. That's really beautiful to have that relationship for like such an extended period of time. It's like to have a new therapist and to be like, okay, here's the thing. What
Yep.
was it you or somebody that was talking about make the PowerPoint?
Oh
I
my
don't
gosh.
know.
Yes, I've had
Was that
clients make
you?
the PowerPoint for me before. It's been the best thing ever. I love the
Yeah.
PowerPoint.
Make the PowerPoint. Essentially, yeah, you make a PowerPoint of this is everything and this is the
Yep,
information you need to know like at the beginning of the session. Um,
exactly.
I think I saw that like 2 days ago. That's so funny.
So
I want
funny.
to ask you one last question,
Hit me.
and because I know you have sessions, you are a busy, busy bee. Um, so I'm curious about this. One thing I love is I love hearing the best advice or like things that people have given. So I'm gonna give mine,
Yeah.
and then just like in the frame. So mine is from Nicki Minaj, and love. Nicki Minaj was accepting an award at an award show, and she says, "Follow your dreams, because one day you'll wake up and your dreams will be gone and you'll be mad, but be mad at your goddamn self. That was the
Oh.
line. This was like 2015, and I remember like watching that, and I was like, "Oh my God, she's so right."
So right.
So I'm curious about if there anything like that that's coming up for you that you're hearing, or some phrase or quote or whatever, or anything.
Oh, I haven't thought about a good quote. I'm trying to think of Taylor Swift because she's my favorite person in the whole world
Hmm.
in this space. I for some reason the was I loud in my own house that I bought with
Oh,
my
that
own
I
money,
bought with my
with my
money.
own songs that I wrote is coming up for me, and that's kind of like Reputation was out when I was in treatment. It came out when I was in treatment. My friend Claire sent me an email with a like probably LimeWire downloaded version of Gorgeous when it was one of the singles. So like
Hmm.
that was for me. I was like the whole era of that is kind of like how I still live my life because her coming out of that place and then going on the Eras tour and like doing so many different things, reinventing herself so many different times. Like she was always my inspiration ever since I was like watching her on YouTube and then debut came out. But when that happened, I was like, oh, you don't have to be perfect.
Hmm.
You can mess up and you can mess up in a big way, or you can be misunderstood in a big way and you can use it to your advantage and you
Hmm.
can change your whole trajectory of your life that way. So this is not a quote by any means, but obviously I've been listening to it a lot lately now that we can because she owns it again. But yeah,
Hmm.
like was I loud in my own house? And that's kind of how I feel about my social media these days. Like, yes, I still think that I'm so cringe. And I think about like who's DMing my videos. Not that
You
anybody,
are. No, I'm
well,
kidding.
no, I like am. But like I'm like then I'm like, wait, maybe no one is. And then also who cares? And then it's like,
Who
was I loud in my
cares?
own house that built my own business?
Hmm.
Sorry. Like get your bag. And if
Hmm.
you're not, then you're just kind of scared and insecure. So
Yeah.
that's how I feel about it.
Hmm. Thank you. Thank you. Thank you. Thank you.
Oh my gosh, you're the best.
One last thing. I
Yeah,
swear to God. I swear
you're
to
fine.
God. And this might be controversial. What do you feel about not receiving the re-recorded version of Reputation?
Oh, I don't care at all because you know
Okay.
what? Her saying it couldn't have been made better. I was like, you're right, girl. And that's another pat on the back for her. Like, I
Hmm.
want the vaults. Don't get me wrong.
Right.
I think that there's probably some good songs that didn't make it on there that I would love to hear.
Hmm.
And debut, I need the vaults because I need I'd Lie. And if you haven't heard that song, you need to go
I
find
haven't.
a
I'll go. Yeah.
oh
I'll.
my God. Go look up I'd Lie. This is for everyone listening. Go look up I'd Lie after this, and you are gonna have your life changed. And I want you to picture me singing that on a the eighth grade talent show with my dad's guitar. Okay?
You did.
Yeah. Oh, I did.
Oh
I
my
have
God.
videos.
The icon, the legend, the moment. Um. Oh my God. Thank you so much for coming on. Thank you.
You
Thank
were
you.
the
Thank you. Thank you.
oh my gosh.
Um.
Thank you for coming to my event and meeting me and asking me to be on this and just like showing up as your authentic self on here. We need you in this
Ah.
space and keep taking it up, okay?
Thank you. I will. Thank you. Thank you. Thank you. And yeah, we'll see you on social media.
See you soon.
Bye.
Bye.